بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أنا دكتور حاتم أمين خطاب، استشاري أول طب جراحة العين بكلية الطب ومستشفيات جامعة الزقازيق. حديثنا معاكم النهاردة عن الكيميكال اي انجرز. بنقول إن الكيميكال اي انجرز دي ممكن تعتبر الموست سيريس ophthalmic emergency وبتحتاج المانجمنت within seconds. Otherwise the eye may be lost. الكيميكال بيرن بيحصل امتى؟ when a liquid وده يشمل الكونكريت والهاند sanitizers or powder chemical contacts the eye. لو تخيلنا بعض الاكزامبلز للقصة دي، هنا اكزامبل للليكويدز او للكيميكال باودرز اللي هي ممكن تعمل contact with the eye وتعمل لنا الكيميكال injury. في اشكال مختلفة للكيميكال injuries اللي ممكن تأثر على العين، سواء في أماكن العمل أو سواء في المعامل. بنقول برضو إن الكيميكال injury ممكن تحصل نتيجة eye wrapping with hands contaminated with chemicals. Rarely ممكن إن الchemicals دي splashed into the eyes can also cause poisoning as they are absorbed into the bloodstream many times more rapidly than chemicals splashed onto the skin. Concerning epidemiology of chemical eye injuries, reported إنها تحصل في من حوالي 12 ل 22% من الأوكيولار تروما، نسبة محترمة جدا ويعتد بها جدا. تلتين من الكيسز بيبقوا ميلز. على فكرة الميلز أكتر 6 اكسبورد لكل أنواع التروما، سواء كيميكال سواء penetrating سواء بلانت. الورك بليس is the commonest location for a chemical injury. قد يكون في المعامل، قد يكون في أماكن البنى المختلفة. الحاجات بتاعة التنظيف دي حاجة من الحاجات الشهيرة للكيميكال انجريز في المنازل. معظم الكيميكال انجريز بتبقى alkaline in nature، وده اكزامبل لبعض الحاجات الهاوس هولد كيميكالز اللي ممكن تعمل لنا اوكلر انجري، سواء كانت alkaline او كانت acidic. ده برضه other list of the chemicals that may produce chemical ocular injury. لو جينا بقى نتكلم عن pathophysiology of chemical ocular injury. الchemical damage by severe chemical injuries بيمشي في التسلسل الآتي: بيحصل necrosis of the conjunctival and the corneal epithelium, disruption and occlusion of the limbal vessels, loss of the limbal stem cells, conjunctivalization and vascularization of the corneal surface, persistent corneal epithelial defects with strial corneal ulceration and occasionally perforation. Long-term effects بتشمل ocular surface wetting disorders, symplepharon formation, and cicatricial intravium. Deeper penetration causes breakdown and precipitation of glycosaminoglycans and stromal collagen opacification. Anterior chamber penetration causes iris and lens damage. Ciliary epithelial damage impairs ascorbate secretion, which is required for collagen production and the collagen repair. Hypotony and ptysis palpi may ensue in severe cases. Alkali agents are lipophilic and therefore penetrate tissues more rapidly than acids. They saponify the fatty acids of cell membranes, penetrate the corneal stroma, and destroy proteoglycan ground substance and the collagen bundles. The damaged tissues and then secrete proteolytic enzymes which lead to further damage. Acids are generally less harmful than alkali substances. They cause damage by denaturating and precipitating proteins in the tissues they contact. The coagulated proteins act as a barrier to prevent further penetration, unlike alkalis. There is an exception for this rule: hydrofluoric acid, where the fluorine ion rapidly penetrates the thickness of the cornea and causes significant anterior segment destruction, very similar to that caused by alkalis. The severity of ocular injury depends upon toxicity of the chemical and its concentration, time of contact with the eye, the depth of penetration, as well as the area of involvement. A hot solution generally causes more damage than a similar cooler one, since the chemical reactivity usually increases with a rise in temperature. Solid substances are not removed by blinking, and corrosive powders like lime and concrete may remain in greater concentration in conjunctival sac and thus have a higher chances to destroy the tissues. Lime particles in particular may cause severe ongoing damage if they remain unnoticed in the deep fornices. Regarding acid batteries of cars, a combination of acid burns and ocular contusion has been described for exploding modern car batteries. It's very helpful to obtain the packaging of the chemical to know its chemical nature and its concentration. Regarding the classification of chemical injuries, a lot of classification has been adopted. These are two examples of the most important classifications of chemical injuries. This is an example of a limbal ischemia induced by a chemical burn. Grade 2 chemical burn, a corneal haze but visible iris details. In the next degree, the corneal haze obscures iris details. In grade 4, the cornea is opaque. As concerns the symptoms of a chemical burn, burning and eye stinging, ocular redness, ocular pain. Don't judge the seriousness of your eye injury depending on the degree of pain. Alkali chemicals don't usually cause significant symptoms, but can seriously damage the eye. Eyelid swelling, photophobia, foreign body sensation, as well as blurred vision, blepharospasm, and lacrimation. What about the complications? A lot of complications can occur in chemical ocular injuries. It's an example of conjunctival pans and symplepharon. Anterior symplepharon after an alkaline injury. Symplepharon and corneal scarring after alkaline burn. Corneal vascularization, which reflects limbal stem cell deficiency. Limbal ischemia after an alkaline burn. Extensive ischemia after alkaline burn. Most serious ocular injuries are due to alkaline injuries. Acute intraocular pressure elevation. Initially, this is due to corneal and scleral shrinkage. Later on, fibrotic damage to the trabecular meshwork, as well as inflammatory debris trapped within the trabecular meshwork, is the cause of elevated intraocular pressure. Cicatricial intraobium, corneal scarring with panus formation, extensive cicatrization, complete cicatrization of the corneal surface following a chemical ocular injury. This is the slit lamp appearance of the right cornea 4 weeks after the chemical burn, and the same cornea after 1 year. After 1 year, it is evident that there is corneal neovascularization for the whole circumference, extensive venous formation, and superior nasal symplepharon. This is a corneal opacity with severe ectropion of the upper eyelid following a chemical burn. Ectropion occurs to shortening of this lid skin. This may be the end result of severe bilateral chemical burn. This is an example of the effect of chemical trauma on the cornea. There is a central stromal haze and melt with a large epithelial defect stained with fluorescein. Conjunctival inflammation and loss of goblet cells can leave the ocular surface prone to dryness, scarring, and contracture of the fornices. And in the last resort, we may need a keratoprosthesis. As an example of corneal ulceration in chemical ocular burn. Another example of corneal ulceration following a chemical ocular burn. And this is the last example with us for corneal ulceration complicating a chemical ocular burn. Corneal perforation, cataract, and retinal damage may be complications of severe chemical ocular injury. How to manage such cases? The common goals of management include removing the offending agent, promoting ocular surface healing, controlling inflammation, supporting the reparative processes, and prevention of complications. Irrigate, then irrigate, then irrigate, then irrigate, then irrigate. What else? Irrigate, then irrigate, then irrigate, then irrigate, then irrigate. What else? Irrigate, then irrigate, then irrigate, then irrigate, and irrigate. This is so true. Irrigation is the most important item for success of treatment of a chemical injury. Hold the face under running water for 15 to 20 minutes and allow the water stream to flood the eyes. Use the fingers to hold the eyelids apart. Make sure that there is no trace of the chemicals on the fingers. If he or she wears contact lenses, remove them as soon as possible. Topical anesthetics present are of great help. The endpoint for irrigation may be guided by pH indicators, if available. The insertion of an eyelid speculum would be of great help. The use of intravenous sets for irrigation would be of help also. Alkaline injuries, especially if absolute, may need a longer time to get neutralization. There is no place to antidotes in chemical injuries. Any particulate matter should be removed. Additional choices include corticosteroids, cycloplegics, ascorbic acid, antibiotics, citric acid, and tetracycline. Concerning the advantages and disadvantages of corticosteroids, corticosteroids reduce inflammation, reduce neutrophilic infiltration, and address uveitis. However, they also impair stromal healing by reducing collagen synthesis and inhibiting fibroblastic migration. Consequently, topical steroids may be used initially and tailed off by 7 to 10 days when sterile corneal ulceration is most likely to occur. Steroids may be replaced by topical, non-steroidal anti-inflammatory drugs which don't affect keratocytic function. We usually use preservative-free artificial teardrops for the dryness, complicating chemical ocular injuries. For acute glaucomas, complicating ocular chemical injuries, oral aqueous suppressants are generally preferred over topical agents. Concerning surgical management of chemical ocular injuries, it starts with initial debridement of the necrotic material and continues with amniotic membrane transplantation and tectonic grafting if necessary. Later, we may resort for surgeries to correct eyelid abnormalities, to treat glaucoma, to do limbal stem cell transplantation, and ultimately keratoplasty. Prevention is much more important than treatment. It's very important to use safety protective goggles in any case that's liable to chemical ocular injuries. For children, keep all hazardous home products away from them. Know your chemicals. Check the chemicals label and its material safety data sheet for information on safe handling. Strictly follow the manufacturer's instruction. Which is safer? Glasses or contact lenses in locations where chemical eye injuries are more expected. Don't wear contact lenses. A contact lens may absorb the chemical and concentrate the burn on the eye surface. When working with chemicals, wear prescription glasses instead of contact lenses, and always wear protective equipment over the glasses. For effective contact, this is my WhatsApp number. This is the Facebook page. This is the YouTube channel. The appearance of the YouTube channel. This is my team. Don't forget to subscribe, like, share, and comment. Thank you.